So Kelly provided a lot of interesting insights on how we must tread carefully with the digitalization of healthcare. And one key point that's worth further emphasizing is that despite the potential perils of digitalization as it stands today, there are tangible actions that we can take to resolve those issues. Now, as behavioral scientists, of course, our stance is that resolving issues with digitalization start with the application of behavioral economics and behavioral insights to develop solutions that would overcome key challenges. So in this next section, we would like to show you how behavioral economics can be applied with some illustrative examples. But before we dive in, it's important to take a step back and note that the promise and the dangers of digitalization are pervasively relevant across all sectors of healthcare. So whether you are in pharmaceuticals, health insurance, digital health, or beyond, your organization is likely going through a digital transformation. In pharmaceuticals, you might be looking at the creation of digital technology to better support patient decision-making or physician training. In health insurance, you might be looking at supporting digital tools that help patients better adhere to their treatment plan, or even better, adhering to behaviors that would prevent disease. In digital health, you might be directly creating the technology with the goal of improving people's health and overall well-being. Now, the digital transformation that your sector is going through likely raises some burning questions. For example, how do you get people to use the technology? And just because the tech exists, this does not mean that people will use it. And if they do, it does not mean that they will use it correctly and consistently to achieve the health outcomes that they want. So how do we solve for that? So a traditional starting point to getting people to use the tech might include the following: giving people more information about the benefits of the tech, providing more information on how to use the output, or perhaps you may consider providing people with incentives to use the tech correctly and consistently. But time and time again, research has shown that information and incentives alone are not enough to change people's behaviors. Now, note that we're not saying that information and incentives do not work, but rather, we know that these approaches alone are usually not strong enough to produce large, long-lasting behavior change. We need something more. So in comes behavioral economics. Behavioral economics brings a different way to think about challenges. And the behavioral economics lens is this: we as humans do not operate as if we are robots. We are constrained by time, resources, and willpower. In other words, we are boundedly rational. We therefore rely on heuristics or mental shortcuts to make decisions. So for example, in the mornings, I automatically know to brush my teeth. I just do it. I do not have to weigh the pros and cons of doing so. It's simply the status quo. But these heuristics make us vulnerable to biases. I, for example, am vulnerable to the status quo bias. And these biases mean that our choices can be inconsistent with our needs, preferences, and interests. So my status quo to not exercise is inconsistent with my interest to achieve better long-term health for myself. But luckily, for people like myself who do want to change their behavior, our biases are large and systematic enough that we are predictably irrational. The status quo bias will always be a pervasive bias for me, and maybe for you too, but that's predictable. And since it is predictable, we can do something about it. So therefore, with expertise, we can tap into these irrationalities and nudge people to act according to their interest. And we can do so by changing the context in which they make their decisions. In other words, changing the choice architecture. Now, beyond recognizing that people have biases and that we can leverage these biases to help people achieve their health goals, behavioral economics also brings a different way to solve challenges. On the screen, you will see the 3 pillars of behavioral economics. The first pillar is research. The focus here is to diagnose the why. Why are people behaving in the way that they are or aren't? What biases and psychological barriers get in the way? Knowing these biases allows us to develop strategies and solutions. This is the second pillar. In the second pillar, the question that we want to answer is how. How do we overcome these barriers? What are the hypotheses and interventions that we can develop to change the choice architecture? Having those hypotheses and interventions in hand, we move into the third pillar, impact evaluation. Here, we can run randomized controlled experiments to test the hypotheses and to determine will it work? Does it work? And if so, by how much and why? So let's go through these pillars in a bit more detail. On research, the starting point is to identify the target behavior that you want to achieve. We need to first establish what is the overarching business goal. In our case today, it might be to increase digital tech usage. We then take this overarching goal and turn it into specific patient or physician behaviors that we can track and measure. Knowing what the target behaviors are allows us to ask the question, what's in the way of this target behavior? So let's see this through an example. For illustrative purposes, let's assume for a moment that you have an app that helps prevent kidney disease progression. It asks patients to log their daily food intake and whether they've gotten their dialysis treatments that day. The app might also log other relevant health data. So based on this information, the app tells the patient the status of their kidney function, good or bad. Using this information, the patient can then adjust their food plans and adhere better to doing their dialysis treatments. In this example, therefore, some of the key target behaviors we'd want patients to achieve might include the following: daily logging of their food and dialysis, doing a review once a week of their progress. Based on their progress, adjust their food plan and doing their dialysis treatments on time. But if your organization owns an app or tech like this, you will be all too familiar with the obstacles to getting patients to use such technology. People might start using the app, but then not log their data. If they log their data, they might get lost in the weeds with the details of the information that they're getting. Or they may be overwhelmed with the data and they avoid it altogether or ignore it. Worse, at some point, they might just abandon the tech. So what gets in the way of people using digital tech for their health? Years of cumulative expertise in behavioral science tells us that it's more than just the process journey. It's also about the psychological journey. That is to say that we need to do more than just map the steps that people take to achieve their target behaviors. We also need to develop an understanding of their psychological journey. Taking a closer look at the psychological journey allows us to examine the questions. Are they aware that the tech exists? Does it capture their attention? What do they perceive about this tech? Do they perceive it to be easy to use, accessible, of great value to their life? Can they trust it? Based on their perceptions, how do they evaluate this tech? Can they use it? Would they use it? Should they use it? This then gets funneled into a decision point. Can they produce an intention to act? And lastly, do they act? And can they maintain that behavior? Let's anchor this back to digital tech usage. What are some potential barriers? Let's assume for a moment that the patient is aware of the tech and of its benefits, features, how to use it, etc. Focusing in on the middle sections of the psychological journey, we know that on perception, the features that provide people with a peace of mind can also increase feelings of unfamiliarity. For instance, being able to track a lot of my health data can give me a peace of mind that this information is being stored somewhere and is being used somehow to improve my health. But having all this information can increase feelings of unease. What do I do with it? I'm not sure where to start. And this is because we know that people cannot intuitively interpret data and statistics. Even if the information is presented to them in a simple manner, people may not be able to translate these outcomes into a proper course of action. Lastly, features that entice people to adopt the technology can be the same features that prevent people from using it. This is because we tend to be overly optimistic with how useful certain features are for our future selves. At the outset, we're drawn to having lots of new, exciting functionalities, and we overestimate our future willingness and ability to use those features. So a question you might have now is, well, how do all these barriers relate to each other or interact? Now, their interaction can be summarized in the simplified tech adoption model. This is the simplified tech adoption model. So as we've already discussed, perceived ease of use on the left-hand side directly affects our perceived usefulness of the tech and the data. These factors, in turn, influence people's attitudes and intention to use the technology. Intention then trickles down into actual usage of the tech. Another factor that also influences people's intention can include, well, does the technology provide demonstrable results for me? Is the call to action effective? Zooming into the behavioral intention, into actual tech use part of the model, we also know that feature fatigue can be a key driver of a disconnect between people's intention to use versus actual use. That is, feature fatigue can create a say-do gap. Low self-efficacy is a key factor as well. Self-efficacy generally refers to a person's belief that they are able to succeed in accomplishing a task. So if it takes you forever to figure out how to use something, this could decrease your feelings of self-efficacy. So let's now come back up for some air. What does this all mean? We'd like to put forth 4 key hypotheses on how the dangers of digitalization can be resolved by providing people with careful guidance on how to use the data. First, reduce feature fatigue. Plainly, less is more. Provide the right level of data at the right times at the right frequency. By doing so, you will increase people's self-efficacy when they use your tech. Third, increase ease of use and actual usefulness. Pair the filtered data with heuristics or rules of thumb on how to interpret. Help people interpret the data and then simplify the interpretation. Lastly, help people create demonstrable results. Achieve this by linking the filtered data to specific calls to action.